Hi guys, my name is Hong Kai. I am the Clinic Director and Chief Physiotherapist over at Benchmark Physio. Today I wanted to talk about common foot condition called plantar fasciitis and perhaps provide a physiotherapy perspective of how this condition is commonly managed. Do follow us on our socials on Facebook and Instagram for useful tips and information about various musculoskeletal conditions, as well as how it is commonly managed with physiotherapy. So we'll jump right in now to talk about what is plantar fasciitis. And what it essentially is overload of the plantar fascia, a band of connective tissue at the bottom of the feet. When it's overloaded, often what people get is pain around this region of the heel where my cursor is. And in some cases, there might be inflammation at the insertion point between the soft tissue and the bone. Symptoms-wise, usually what we see in clinic is that there may be tenderness when we press this region of the heel, inside of the heel. The first few steps in the morning may be painful, so patients often will report this. They would say that, like when I get out of bed, the first few steps is extremely painful. It's almost like walking on glass. Often it gets better once you start moving, for the next 10 steps, for the next 20 steps, it starts to ease off a bit. But usually gets worse again once you start to expose it to long activity or activities that are very impactful or stressful for your plantar fascia. So things like running, walking barefooted, walking on your toes, going upstairs, all these can potentially aggravate your plantar fasciitis. So what are some of the common causes of plantar fasciitis? We find that plantar fasciitis presents in the sedentary, overweight individual, so people who don't do a lot of exercise, and also in very fit, active runners. And in these two patient populations, often what we'll see is that there's training error there, so they might be trying to do too much too soon, or they may be trying to expose themselves to bouts of unaccustomed activity. So to put things in perspective, if we look in the sedentary overweight individual, maybe a classic scenario would be that they suddenly want to be put on like a weight loss program. They suddenly want to be exercising 5 to 7 times a week. And the plantar fascia cannot keep up with the load demands that are being placed on it because it's not accustomed to exercising 5 to 7 times a week. So what then ensues is that the plantar fascia is now inflamed and painful. The other scenario that you often see in your very fit, active runner is perhaps if they're training for a marathon and they realize that there's not enough training time leading up to the marathon, and they decide to ramp up their mileage, their weekly mileage very quickly. And sometimes what can happen is that if the plantar fascia is not accustomed to the load that's being placed on it, you can quickly then start to get overload of the plantar fascia, inflammation, and pain. Some other factors that we commonly look at when looking at plantar fasciitis would be things like your biomechanics. So if you have flatter arches, so you have flat feet, lower arches, or if your arches are higher than usual, what you may notice is that may increase the strain on the plantar fascia, which may then lead to plantar fasciitis. We find that factors such as tissue tightness, in particular tight calf muscles, that is a risk factor for plantar fasciitis. And the reason for that is that because your calf muscles attach to your Achilles tendon. So if you look at the picture here on the right, so your calf muscles, if they are particularly tight, they attach to your Achilles tendon into the bone. And usually this whole unit is continuous with your plantar fascia. So if this area starts to get quite tight, so this area where my cursor is on, you may notice that will increase the strain on the plantar fascia, which can then lead to plantar fasciitis. Something else that we commonly look at is your footwear. So obviously, if your shoes are quite worn out and quite old, they may have poorer arch support cushioning, and that can also increase the amount of strain or load on the plantar fascia. Something that we often will try to assess in clinic would be the strength of your calves and intrinsic foot muscles. Because obviously, like the stronger your muscles, the more protective it would be of your plantar fascia. So with stronger muscles, less load on the plantar fascia, you're less likely to develop plantar fasciitis. I might make a pause here. We'll talk about the common physiotherapy management options for plantar fasciitis in the next video. See you then.